Assalamu alaikum warahmatullahi wabarakatuh. The article of this week titled Outcome and Associated Predictors for Non-Surgical Management of Large Cysts like Periapical Lesion, a CBCT-based prospective cohort study done by Saini et al. And published in the IEJ in 2023. Predictive factors are measures associated with success or failure with current treatment. These factors help determine the best treatment options and prognosis for various dental diseases. Factors like the absence of preoperative periapical radiolucency, quality of root filling, as well as coronal restoration significantly improve root canal treatment outcome. The presence and the size of apical lesions negatively impact periapical healing and decrease the success rate of root canal treatment. Also, CBCT can measure changes in the periapical lesion volume and serve as a quantitative method for monitoring healing. So the aim of the study was to evaluating the outcomes of root canal treatment in large cysts like periapical lesion and identifying predictive factors affecting success and changes in periapical lesion volume after root canal treatment. For the materials and methods, the study evaluated patients with large cysts like periapical lesion of endodontic origin between October 2017 and November 2018. The study assessed 1,350 patients referred for root canal treatment of anterior maxillary teeth. For the exclusion and inclusion criteria were SCA1 and aged from 18 to 55 with large cyst like periapical lesion more than 10 mm associated with non-vital periodontally healthy maxillary anterior teeth. For the exclusion criteria, patients with specific medical condition like diabetes, tobacco use, narrow storable teeth, vertical root fracture, or previous endodontic treatment. Patient clinical data were collected and radiographic imaging was conducted using CBC scan. The root canal treatment was performed by single operator. For the follow-up, assessments were conducted at 6, 12, and 24 months with CBCT scans for lesion volume calculations. Also, the clinical and CBCT-based outcome was classified as resolved by mean clinically asymptomatic complete resolution of the periapical lesion, reduced clinically asymptomatic reduction in the lesion volume reduced by 20% or more, enlarged clinically symptomatic or asymptomatic increase in the lesion volume enlarged by 20% or more, and changed clinically symptomatic or asymptomatic no change in the lesion volume. Also, the 10 preoperative predictive factors evaluated were gender, age, the presence of soft tissue swelling, tooth discoloration, pulp canal obliteration, open apex, root resorptions, type of cortical bone defect, and lesion volume. Also, the 4 intraoperative predictive factors evaluated were the apical extended of root filling, density of root filling, number of treatment visits, and the type of root filling material. Moving to the results, a total of 54 patients, 77 maxillary anterior teeth were initially enrolled in this study. 3 patients required surgical intervention during the study, and 6 patients were unable to return for follow-up due to COVID-19 related travel restrictions. At the 24 months follow-up, 45 patients, 68 teeth were reviewed, resulting in 88% recall rate. The patient's mean age was 26, and all patients experienced large cyst like periapical lesion due to traumatic dental injuries. Significant reduction in the lesion volume were observed, with complete resolution in 8.9% of the patients, reduction in 73.3%, and no increase in the lesion volume. Moreover, 82.2% of cases were classified as successful outcomes based on CBCT scan analysis. 3 preoperative factors, age, presence of swelling, cortical bone defect, and 2 intraoperative factors, apical extent of filling, and number of treatment visits, were found to be significantly affect percentage change in the lesion volume. Preoperative cortical bone defect and apical extent of root filling had a negatively associated with the lesion volume reduction. So, for the conclusion, large cyst like periapical lesion might be successfully managed with root canal treatment. Investigated pre and intraoperative predictive factors did not affect treatment outcome. However, preoperative palatal cortical bone defect and long apical extent of obturation might influence osseous healing. And thank you.